West Virginia is a major casualty of the drug epidemic and taking innocent victims along with it. So it's a big deal that they are opening a much-needed new 20-bed inpatient substance abuse facility in Beckley. Julian Risberg has the emotional story.
Being a part of this is a passion for Michelle Simpkins.
People are dying from this, and we're just here to help fight it. Addiction is a disease that we are all here to help fight.
Hope for Tomorrow residential facility patients stay about 30 days and up to 60, and the center will continue to add additional services as they build the program out. They get patient referrals from many different sources.
Some of them come from other professionals. They may come through the ER. They may come from their doctor. They may come from a family member. They may come from a probation officer, or they may just be self-referred. In Beckley, because it's a larger city with more medical services here and closer hospitals in the area, we do expect to see an increased amount of folks from medical facilities like the ER, from the VA. We treat VA patients.
For all the negative associated with addiction, there's something beyond that.
The positive is seeing our patients come through the door and knowing that we're going to help change their lives.
Waymark is the largest opioid treatment provider in North America. This is what they do. According to VP of Business Development, they use MOUDs, medication for opioid use disorder, in all of their programs and on a long-term outpatient basis. Hope for Tomorrow is for those who need to be in a safe inpatient environment with a more intensive approach where they can be monitored.
Folks who have maybe a more complicated scenario in terms of their ability to stay sober, we do treat folks for what we call co-occurring disorders. So they might have a severe depression or anxiety diagnosis along with their addiction. Those folks may have a harder time just going straight into outpatient and doing it on their own. Those folks do really well when they come in and get some intensive time with us in residential, and then we transition them into outpatient.
Vaughn Bell says their management team practically renovated the building themselves, so it's become a labor of love.
It's very important for us to feel like this is a homey environment for our patients. You can see we've made an effort to make it really warm and comfortable. We really have a hard time keeping up with the volume of patients who need services at Point Pleasant, so we're ecstatic to be able to open the second location, and there's just not adequate amount of services in this part of the country.
Witnessing transformations is emotional for the Director of Clinical Services, Michelle Simpkins.
We get to see the growth of them and just visually see it. We get to help get their kids back, get their license back, whatever that we can do for them.
At Hope for Tomorrow in Beckley, Julian Risberg for Newswatch.